All right. Record this for those who are unable to be here today. First of all, I want to introduce myself. I'm Dr. Nancy Hadley. I am the academic coordinator for the 3 Ps. This is a somewhat new role for me. I've been with Walden for about 10 years, teaching mostly in the 6531 class, which will be your next class after the 3 Ps. So getting started into the clinical classes. I'm meeting with y'all today because there were quite a few concerns that were voiced regarding the week 7 and week 9 iHuman case studies. So I wanted to just kind of discuss some of the concerns that you have and the findings from the leadership review that we've been conducting. First, let me just say that we've been using iHuman for about 4 or 5 years. I've personally graded thousands of these submissions with from students. Overall, it's an excellent way for you to hone your interview skills, figure out how to do your physical exams based on your patient presentation, develop a differential diagnosis list, and then learn how to put all that knowledge together to come up with a plan of care. This is something that we do because it is a safe environment for you all to practice on those face-to-face encounters that you're going to start having very, very soon. We've worked really closely with iHuman, with their team. It's a separate, it's not a Walden product. This is a separate company, but we've worked with their experts. We constantly are giving them feedback on cases that that we get embedded into our course curriculum. If concerns come up on these, then we discuss them with the iHuman staff. They've been really, really good about updating and improving cases. And most recently, they started.
Mateo was born a whole month early.
Can I have you mute yourself with? Let me see. Okay. So they recently started developing premium cases. Those are more intuitive on the interview questions that are posed. So it's a little bit easier for that question and answer session that happens. They're replacing the original cases with these premium cases, and as they're becoming available, but we should be fully transitioned to the premium cases in this coming year. So we're getting close. The week 7 iHuman case that caused a lot of angst with everybody. Let me first just say it was kind of a unique presentation. It was one that we haven't seen before, but this was the 18-year-old student that had a syncopal episode on the sports field. It's the first case study that we've had that's required information gathering from multiple sources. Usually you just talk to your patient, you get through the information, and then you move on with your case. With this one, it required the patient interview, it required bystander, and it required some family. And because of this, most students didn't get to those bystander and family questions. And so it led to that lower overall score on the information gathering or history taking. I know it's disheartening when you see a result like that. I get it. I've been a student. I understand. We're all kind of focused on each and every one, and we want to do our best. Totally get that. Every one of y'all that are in this program right now, you're all an RN. So you are obviously intelligent beings. You've made it through several master's classes already. You have the intelligence, you have the drive to do this and get through this class. That part's not in question. But we are going to continue to push you and test you to expand your knowledge base and prepare you for the responsibility of having your own patient load as a new NP when you're done. So that push will continue through this whole thing. We want you to, I don't want everything that you do you automatically know everything. If that was the case, you already know it, you don't need to be in school. We're trying to push you and help you expand and develop. So keeping that in mind, are you going to make 100 on everything? I certainly hope not, because that means we're not really challenging you. So keeping that in mind. Now, as RNs, if you step back, as an RN, you realize the importance of the history taking on each of your patients that you encounter. You have to do that part. So whether you're a young person or an elderly person that you're interviewing, if they pass out, intuitively, it's one of those, you need to inquire about what happened from the patient perspective. You need to know what happened from the bystanders that witnessed it when the patient was unconscious. And hopefully, if there's some family there, get some more family history so you know more about what's going on. But I think as a student, you get really focused on the task at hand and the assignment in front of you, and you don't always stretch back and reach into the information you already know. And so this just takes practice in order to do that. And kind of with these cases, I think this past one kind of highlighted this. Because I can assure you, if I sat down and talked with any of you all individually and told you, hey, this patient passed out on the field and now they're awake, but we need to go and find out what happened, you would go down there and you would ask all of these things. So I don't think that and I bring this up because I think that the week 7 case, the overall case was valid. I think asking those types of questions were valid. I also understand that it can be kind of difficult to kind of pose the questions, and it gets frustrating, especially in these the original cases where it's not quite as intuitive about what you're asking versus what they want you to have by word for word. But we also realize that because this case was unique, it may be a little bit more advanced than what a brand new NP student coming in that haven't done clinicals, what you would be able to handle. So it's not that we think that you can't do it or that you don't have the brains to do this. We realize that, but what we've done is, because everybody globally kind of had the same issue where on the history taking, they were kind of everybody seemed to be pretty single focused on it. And so because of that, as a leadership group, we decided to do the full credit on the history section of that assignment. Keeping in mind, with every assignment that y'all do in your class, throughout all of your classes, you have these competency requirements that you need to be able to show that you've met. But that was one of the things. Well, if we give them full credit for the history taking, then what happens with the competency? But you have multiple iHuman assignments throughout the quarter. So you show we do that history taking on each one of them. So we understand that you can get that competency met by the other assignments that you're doing. So that wasn't a huge concern on that part, but it was one of the considerations that we looked at. So let me make sure I've got everything here. But wanted to keep in mind, it was only the history taking part of the case study where we decided to do the full credit. I think the remainder of the assignment was appropriate for this level of course. So if hopefully I sent out an email to the instructors on the 12th to let them know about the full credit on the history section, and hopefully it filtered out to all of you and showed up in your announcements, which I really strongly suggest that you always watch those assignments. From an instructor standpoint, after 10 years of this, I can tell you there's just so much information you'll find in those announcements. So be sure to read those. But hopefully everybody got the information about that week 7 iHuman history taking section. Now I want to discuss the week 9 because that's here in our face. It's right here. I will tell you that this case has been utilized before. It's not a new case for us. There are no unique characteristics on that. It should be a very straightforward history taking session. Just utilize your knowledge base that you already have. Ask the pertinent questions. It doesn't require you to obtain history from anyone except for the patient. So that presentation should be a bit less cumbersome on this one. The presentation that you're going to have in the week 9 is one that you're going to see in your professional work, and it does have very important aspects of care on it. So it is one that like I said, we've used before, and I think that you will find that it is a a lot more straightforward. Now, in Canvas, you're going to see on the week 9 assignment, it said the mandatory pass score of 80. That's not correct. It is 70% on the pass score, not 80. The lowering of this requirement has nothing to do with week 7. I had some emails asking about that. It has nothing to do with that. They did it last quarter also. This is strictly a matter of we were looking at trying to get everything updated. We're doing a lot of course curriculum updates. And so that just slipped through and didn't happen as it was supposed to this quarter. So this was not something that we're like knee-jerk response in regards to the week 7. This has been on the books from the beginning and for last quarter too. We're not lowering the standard for any reason other than we realize that the case simulations can have some limitations on in how you communicate your knowledge based on the questions. And so that's the reasoning for the lowering. Like I said, the changes were made prior to the start of this quarter. It just didn't make the cut on the upgrades. So your instructors know about the change. So hopefully that also has been communicated in your announcements. So if that allays some of the fears, that's our plan. I want for this meeting today is just to make sure that everybody understands that. Now you've all received, hopefully by this time, everybody's received the email about the upgraded changes next quarter for advanced assessment curriculum. Where we're going to take the week 9 iHuman assignment out. We're going to replace it with a skills checklist. I've gotten emails asking about that, feeling that the changes that we're making are as a result of everybody's discomfort with the week 7 iHuman. I just want to assure you that has absolutely nothing to do with that either. Embedding the skills list into our curriculum has been like a years-long process. We are doing this to meet the completely changing that one assignment to meet the National Organization of Nurse Practitioner Faculty requirements. This is a school requirement to show student competency. It has absolutely required hours and hours of discussion, collaboration, review, all of this stuff. So absolutely has zero to do with the week 7. So I just wanted to make sure everybody was comfortable with that. We're finally ready to start instituting the changes next quarter. We're very excited about it. I'm extremely proud of the work that's been done by our leadership team in order to get this into fruition. I think these skills are going to be invaluable information for the face-to-face encounters that y'all are going to be coming up with. I'm sorry that y'all didn't have a chance to do that. Like I said, we've been doing this, we've been working on it. The skills on point is one of the program that we're using for this. And I believe it is something that can be, you can get more information about and still do. So, but it's a one-on-one check sheet or check off that the instructors will do with each student in the course to show competency on, how to use an otoscope, how to use an ophthalmoscope, all of those kind of things. So, so we've talked about 7, we've talked about 9, we've talked about the skills checklist. I have one more little thing I want to talk about, and then I can open this up for questions and hopefully get through all of that. So I appreciate y'all's attention. The other thing that I really want to address is that if you have an issue with an assignment or with something that's going on with your class, absolutely open door, but I want you to realize that your first stop needs to be with your instructor. Your instructor is the one that grades, no one else grades it. If there is a problem with an assignment and you don't feel it's resolved, then I'm the next person to discuss it with you. But keep in mind, your instructor has 48 business hours to get back with you. So if you're emailing on the weekend, they have their personal time. We all also work in practice at least one day a week. And so we're not going to be able, if you're, emailing us on Saturday night, your instructor is most likely not going to get back with you. I know that can cause some angst until she can get back with you on Monday or Tuesday, or we do have males also, but it's one of those, give them a little bit of time. They've got their family time and work time also. There's nothing that can't be fixed after the fact. If there's a real issue that, you can't submit or whatever because of technical issues, that can always be taken care of in the next, 48 hours. It's not something that has to be done on Saturday night or you're not going to get your grade. So give them some time to get back with you. We don't operate in a synchronous, we're a more asynchronous environment. So because of that, it makes it feel like it takes forever, I think, sometimes to get the feedback. But I assure you, they may read their email on the weekends, but they may not respond back right away. So just give them a little bit of time. If you feel like their response with the instructor, like I said, is not going the way you want, then please reach out to me. I have a more bird's eye view of what's going on with the situation. I may be able to identify some resources that they may not know or at a different level. So I'm absolutely able to do that. If I can't do it, if your instructor can't, I can't, then your next step to escalate would be to the program director, Dr. Judy Couric. She is an absolute wealth of information. She has tons of resources, really good insight on a lot of this. And she is directly involved with all of the courses and curriculum. So she has a lot more information than any of us. So great. If you follow this chain of command, you're going to receive resolution a whole lot quicker and with greater efficiency. Dr. Kirk and I do not regrade any assignments. There are not any instructors that will regrade an assignment for your instructor. If you feel like the assignment wasn't graded appropriately, we can certainly talk. If we can't get resolution, then your next course of action is once your class is over and you receive your final grade, then you can talk to your student advisor about a challenge on the grade. We want you to feel heard. We want to know your concerns. I appreciate you voicing your issues that you've had, and that's what I'm trying to address here. Just understand that the chain of command, if you jumping it like way above the chain of command that you need, it a lot of times will delay the resolution, because if you're going to the dean or you're going to the university president, they'll hear you, but what they're going to do is send it back down to us for resolution, and it will delay your response. So I just wanted to let you know there is a chain of command. That's the professional way to do this. We'll get the answers that you need. So, but I thank you for coming, each and every one of you. I appreciate your concern for your education and your inquiry on anything that you are unsure about. I've been there. I was a student. I understand. So that's what I am trying to make sure everybody understands, that we're here to help. Every one of us want to help. We just want to do this the most efficient way, so everybody can have their time. So with that, I am done. I will open it up and y'all can ask questions.
I have a question. The past 2 assignments for iHuman, I've done
I'm
certain
sorry.
physical.
Sorry to interrupt. Hey, Dr. Hadley, this is Dr. Delgado.
Yeah.
Dr. Couric is trying to get in. Dr. Williams is trying to get in. Yes, everything is locked at 100.
Yes, it is locked at 100. And I don't know how to unlock that.
Okay.
So, okay. All right. Thank you. All right. I'm sorry, Jessica. Go forward.
That's okay. I've done heart auscultations. But when I get to the next step, like when I finish it, it tells me that I've never done it, and it's deducted my score.
Right. That has been kind of a common theme I've heard. A lot of it has to do with your program that you have on your computer, and if you work with them, they can make sure that you have the right setup for that. There's also, did you watch the iHuman, ask the professor where it showed you how to go through that, or there's also an iHuman practice where it goes through the auscultation.
Yeah, I did all that.
Okay,
Yeah.
so you got to do like a full minute on each area and all that
Yeah.
kind of.
Oh yeah. I've been like pinpointing watching, especially with week
Yeah.
7, because I'm like,
Right.
week 9's coming up.
Right.
And it still
No.
said the same thing and we can't go back and fix it. So
Right.
it's like, well, what do we do?
Right. Worst case scenario, if you've worked with IT, they have, and with human IT, to help them so they can make sure you have the correct setup on your computer to be able to hear. Then the next step is let your instructor know. Worst case scenario, it may take 1 point off of your physical exams, and that's not 1 point from your total. From your total grade, because you have to keep in mind those percentages on your history taking and your physical exam. That is your overall percentage based on how all students did across the spectrum, in like students, not like professionals that are doing the assignments. So if you're having problems, probably most everybody is. So it kind of all comes into the mix, but that's why we don't do a full grade strictly from what you've done within the program, but we also give you opportunity for the vast majority of your points to come from other areas. So it is minuscule on that one thing if you're not able to get it done.
Okay, thank you.
Good evening, Dr. Hadley. Thanks for taking time for us.
Absolutely.
So obviously concerns have risen for week 7. You did mention about the witness, but it seemed a little counterintuitive with asking the father a question and losing points on questions that he would say and relay back, ask my son.
Right.
So that, and I feel like I've already started my week 9.
Yeah.
And I'm starting to kind of see like a trend as well, like when you ask questions and it just does not lead anywhere else. So what's your best suggestion for that? When they're like, they say
right.
yes, or you ask like, do you have any issues? And they just say yes.
Right. The thing that I find that is the most helpful on the history taking section is, first of all, go through your old carts and ask all the pertinent questions with that. You've got information as far as like a little bit of a history on the patient. You've got the old carts. Develop kind of a little bit of a differential diagnosis in your mind, and then what do you need to do what questions do you need to ask in order to rule in or rule out your differential list, and it usually will send you down the right path as far as the questions. How do you know specifically each and every one? That's always a little bit more difficult to figure out from a student standpoint, because I know that's where those premium cases come from. That helps as far as being more intuitive on where you're going. But you can also, did you watch the Ask the Professor on the history taking section? Because that's really helpful. She's great at that, as far as like, you can start a question and it should populate a list of potential questions that you could do, and you can kind of pick from that as far as what would be it kind of gives you a little bit better how to pose the question.
I guess maybe a direction of understanding where iHuman, because obviously it's already pre-programmed. It's, when we think of, we are all nurses, we have all worked in the field. Right. And my biggest concern is not asking the patient how many drinks does he drink when he's actually in a syncopal distressed state. It's taking care of him in the current condition. And right. A lot of the questions that were derived were all like based on his E2H intake. Mm-hmm. So it's, I guess that's where we kind of lose. And I know it's building differential, but I'm like, are we tunnel visioning ourselves on like, what is the priority? They teach us so much in priority. Like, what's the first thing? Okay, he's diaphoretic. He just came out of, playing football. He's syncopal.
Right.
Right. Now we're asking like history questions, which is diving deep into his ETOH
Right. Well, you have to stop and think what is causing the syncopal episode for an 18-year-old. You know, is it dehydration? Is it, you know, some kind of cardiac arrhythmia? Is it, you know, did he use drugs? I mean, I see it all the time as far as like patients that are coming in that are syncopal because they've done meth or they're, you know, alcoholics and they're in withdrawals, or so there's different things like that, I guess, that you can pick it apart. But the week 7 assignment is one that their questions, like I said, they're valid as far as the direction they're going. I think they're more difficult. And that's one of the reasons why we've used it this first time. We're not real happy with it. We'll probably never use it again. It is one that we'll give feedback to the iHuman company about, but that's the reason, part of the reason why we said, no, just give full points on that one, because it has so many different layers to it that I think were more difficult than needed to be.
All right, appreciate it. Thank you.
Hey, Dr. Hadley.
Sure.
My name's Ami,
Uh-huh.
and I wanted to ask a question because I'm really confused about this.
Mhm.
I work here. I want to be fully transparent. I teach here in another program.
Mhm.
I have 2 doctorates and 2 masters, and I guarantee you that I'm overthinking this. But I do that often.
I do.
But one issue that I'm having is when I go into iHuman, what is the expectation of what I'm supposed to ask? I worked, you know, I've been a nurse for 30 years. I worked in the ER for a long time.
Mhm.
I worked in the ICU. These aren't the questions that I would ask.
Mhm.
So when I go through the physical assessment and I go through the range of systems, it only allows 40 questions, right?
For the history taking.
Yes.
Okay.
And for what I want to ask, I've asked those questions because I thought they were appropriate. But
Mhm.
then when I get the feedback, it says, oh, well, you should have asked this. And I'm thinking, well, why should have why? You
Yeah.
know, it
Well,
didn't
I'm
make
glad you're
sense to
asking
me.
why.
Yeah.
And you should. And why? Can you, when you see your differential list, can you then go in and see where they're going with the questions?
I can, but like, so I had a patient that had a cardiovascular issue.
Mm-hmm.
And when I got the feedback, it was more concerned that I didn't look in his ears.
Oh, well, that's kind of silly. Get it. I totally understand.
Yeah.
Yeah.
And so,
Unless if you think about it, if your patient was dizzy, then was the dizziness a benign positional vertigo? Do they have, you know, is there serous fluid that you can identify behind the tympanic membrane that may be causing the vertigo? So, I mean, from that perspective, yes. I mean, my cardiac patients or any patient that walks in that says they're dizzy, besides listening to their cardiovascular status, I'm looking in their ears 100% of the time because I need to know if that's an issue.
yeah. So you would recommend doing a basic exam on everybody, right? That would be my expectation, no matter
Well,
what they come
it
in
needs
with.
to make sense. I mean, if they're coming in because their big toe hurts, then I'm not going to look in their ears or do a full exam.
Right.
But if they have dizziness, then the next step is what causes dizziness? Is it, you know, is it central? Is it peripheral? Is it, you know, what's going on? And so ears are a part of that to be able to rule in or rule out for a cardiovascular. Do you need it for every patient? No, but they should make sense and that's part of this. I'm glad you asked why on your assignment or on your questions, and looking at your differentials and then review back to your questions that were expected. You should see a link somewhere in there. You may not fully understand it at this point because you haven't been through all the clinicals and you haven't read everything that is going on, but it should all link back. There should be some kind of reasoning why.
And then one last question for you, Dr. Hadley. I was not able to secure a clinical site in time for the spring. But I can take the didactic and then take the clinicals or, you know, in the summer. Would you recommend splitting it up that way, or do you recommend taking it together?
That is such an individual. Hold on, Dr. Couric is sending me a text message, so let me just make sure.
That's okay.
Okay. Oh, they're just telling me we're gonna do another one after this, so, so we can catch all the other people. I will tell you clinicals and you're like 6531, where you're doing clinical and didactic, it's probably one of the more difficult classes that, that you're gonna have for a couple of reasons. One is most of everyone works, they go to school, they've got a family, you've got all these different responsibilities. And it is it requires practice to be able to fully juggle all of that and do it successfully. And so stress is high. There's a lot going on. You're tons of reading, as y'all know. So every one of those is an individualized decision as far as what can I handle? What are my responsibilities at home? If you're taking care of two elderly parents that are living with you and you've got a little kid, and then you want to do, you know, a full course of didactic and clinical, you'll be pulling your hair out before the end of the quarter. So you really have to kind of think about all of that and talk to your student advisor, but both of them take a lot of time. There's a lot of hours that you need to do in clinic. There's a lot of reading that you need to do in didactic. There's a lot of assignments. So yeah, I wish I had the magic answer that everybody needs for each individual one. But like I said, I've done the course for taught both courses for 10 years. And that's I think the one thing that most students don't realize is how much time it's going to take on the next one. So just make sure that you're realistic with yourself. And you're the only one that knows the personal side of it and what you have to do. Sometimes it's easier to cut back a little bit at work if you can, but not everybody can do it because they have to feed their family. So sorry,
Yeah.
I can't really give you 100%, but
That's okay.
That's my
Thank
best
you so much.
Hey,
Hi,
Dr.
Dr.
Hadley.
Hi, Dr. Hadley, I had a question.
Mhm.
I spoke to Dr. Crum earlier today about some of the instructions that were given in the previous weeks and just some questions about the formatting of the management plan and everything. So for week 4, week 7, and even week 10, it says to prepare, we have to identify differentials 3 to 5, but none of that is stated on the rubric. So I was just wondering if there was any way that we could have like an example of like a management plan that you expect from us on iHuman.
Or like the differentials or
Yeah, because
what?
so what I've been doing is just essentially like also stating like differentials in the management plan.
Right. There is a differential section in there that you can pick and choose from, but your management plan, your decision making needs to be driven by, and you know, how do you arrive at a primary diagnosis? It's not like, here it is, this is what I've got, boom, there's your answer. It takes a list of potential problems for you to then, that's where you're using your history and physical to kind of tease out the parts that you need to determine out of this list, what's the most likely diagnosis to arrive at it, and then start working towards a plan from there. So you can't really do one without the other. You kind of need the whole shebang. We're not necessarily focusing in a huge amount on that, but you've got to have one to develop the other. You know, we're asking you to do your history, your physical, come up with your plan, you know, that type of thing. But in your mind, when you're doing it, I know you're already doing it where you're considering, okay, if it's, you know, right lower quadrant pain on a female, what could my differentials be? Well, what's in that area? You got an appendix, you got an ovary, you got a ureter, you got a colon. So you start teasing out the symptoms and your physical exam that you've got, you know, asking about constipation or diarrhea, and they have no GI symptoms, then it's probably not the colon. So then you go to GI or GU. You having burning when you pee? Do you have back pain? Do you have fever or chills? And then if none of the above, then you can kind of rule out it's urinary. So you just kind of keep teasing it out like that until you get to your diagnosis. So that's where your question and answer on your review of your history taking comes from, is you've got to have a basis for why you're asking the questions you're asking. Does that make sense?
Yeah, I was just more along the lines of well, I was more confused on what was required because I understand that for some of the templates that we were given, and including the to prepare for section for the assignment instructions, it was to state differentials, but none of that was stated in the rubric. So I just want some clarification on that.
Okay, I will let Dr. Hurrick know that that was the question, and we can kind of move forward on that. You have to understand, part of this curriculum was built prior to me coming into this, and we're in the process of changing a lot of the curriculum. So I can't give you specifics on the rubric versus the, basically at this point, it's what's on your rubric is what the expectation is. So I'm a little lost in what it is that where you're having the misstep, but I can certainly put you in touch with Dr. Kurek and we can see if we can figure it out.
Okay, thank you.
This is Mirna Gomez.
Hold on just a minute. For Lang, would you please send me an email so I can have your contact information and I can get the answers that you need?
Yeah, sure, no problem. Thank you.
I have a just few questions. This is Mirna Gomez.
There's a couple people that have had their hand raised. Let me talk to them so we get everybody in. They've been quietly asking. I'm going to mess up your name. Emelekeanyi is what I'm seeing. Who is that? You have your hand up.
You said L, you started with L?
No, E-M-E-L. Is that you?
No, it's not me.
Oh, okay, okay.
I can ask question if the person is not here.
Sure, go ahead.
Okay, sorry. This is kind of silly question. Why this week 9 is just pass and fail?
Yeah, so for each class, you have to show competency in order to be able to move forward. And this is one of the requirements that they've had in this course for quite some time. And that's why we're switching it over to the mandatory pass on the skills checklist next time. You'll find that in several classes moving forward. For instance, the clinical courses, there's a minimum score you can receive on your SOAP notes. You can have an overall score in the class that is passing, but you haven't shown competency on the SOAPs, so you would not pass the course. So that's just one of those, depending on the requirements of the to show competency.
Hi, Dr. Hadley. I have a question. It is regarding the famous week 9, and it is being advertised like a head-to-toe assessment. However, we're going to have a case that is intimate partner violence, right? And of course, this case I haven't opened yet because I wanted to have this session before to see if I find any help before starting my exercise. And my question is, of course, we're going to have a psychosomatic presentations due to the trauma that this patient is, suffering because of the intimate partner violence. So, but it says it's a head to toe. So do I focus on the case, thinking about the trauma that the patient has been, going through, or, instead of a head to toe? Can you clarify that?
Well,
yes,
right.
I'm sorry.
So when you're doing when they say a head to toe, you're not going to check everything all, I mean, like you're in the ICU and you've got this brand new patient and you're going from head to toe doing a full assessment, but you're going to have to focus in on where are the injuries and you're going to be able to have to consider that, but you're also going to have to consider the psycho social side of this. And so you're going to have to ask a lot of questions from that perspective on your review of systems. But for your physical exam, you know, focus in on the areas of injury and then move out from there. For every physical exam, you're always, always, always going to do a cardiac and respiratory assessment, no matter what they're coming in for, whether it's a stubbed toe or a heart attack. Everybody gets a cardiac and respiratory assessment, and then move to their, you know, you want to always start and move down when you're doing your assessments, but that doesn't mean I need you to do a Ryan and Weber test on this patient that's coming in for this complaint. That's not what we mean by complete head to toe assessment. You start at the head and you move down when you're doing your assessment, but you always never leave out the heart and lungs. But there may be certain parts of, you know, do you have to evaluate her hair? No. Do you have to, you know, that's what I'm saying is it doesn't mean everything has to be evaluated, but head to toe, start at the head and move down. You all have to get kind of used to doing that type of a physical exam. So, but make it meaningful. What do you need to check? And that's what we do.
Yes.
So
And
Dr.
also,
Hadley, my name is
yeah.
Marianne. I'm sorry. So I was,
Okay.
I'm sorry about that. So
Okay, you just let me
piggybacking on
finish
what
my last question. I
Yeah,
just have a
okay.
slide. I'm gonna close it really quick. So the exercises, you know, they pop out, all right. But it says optional. Is that really optional, or you do have to do it?
The questions at the end, the little
No,
quiz.
the exercises.
Yeah.
Thank you.
No, that's not part of what you're scored on, but they do give you a really good, you should, at this point in your school career, you should answer every possible question that you can come to for those types of things, because it'll help with your overall knowledge as well as kind of clue you in and get you ready for the ultimate test at the end. But no, they're not part of your grade on this.
Thank you so much, Dr. Hadley.
All right.
I'm sorry, Dr. Hadley. So kind of piggybacking on what you just said about the IVP for the iHuman 9. So when you're doing the physical assessment and you're focusing in, like you said, on the bruises, the mental questions, and
Uh-oh, we lost you, Marianne. You went away. Did you hit the mute?
Dr. Hadley, good evening.
Can
Can I ask a question?
Can I ask a question, please?
Let me see if Marianne, are you still there? Oh, she missed, maybe she lost her signal. Okay, Faith, go right ahead.
All right, so my question is, so are the skills starting this week 9 or it's going forward? That wasn't clear to me. Like
No, the skills, you're talking about the skills lab that
Yes.
skills checklist, that's not this
Yes.
quarter. That's starting next quarter for the new students coming into physical or advanced assessment. So
Okay.
it's not something that has anything to do with this course today. It's just letting you know that we are going to start doing that. It went out to all students. Y'all just happen to be in the class that's going to have some changes starting next quarter.
All right, thank you.
Uh-huh.
Hello.
Yes.
I have 2 questions. My first is, as a psychiatric nurse practitioner, I'm a little confused / concerned with like the physical assessments and stuff. I work in a psych hospital already. My doctors and my providers don't even walk around with stethoscopes. So I feel I'm concerned that the questions and things what I'm doing in this class aren't preparing me for what I'm going to do in clinical. Now, granted, I'm a baby, I'm a toddler nurse. So all I know is my hospital.
Yeah. Well,
So
if you're a baby toddler nurse, it hasn't been that long since you've been in school. You should know a stethoscope and which end to use, and
yes,
you've still got it in there. Even psych patients have got to have a physical exam, and at some point,
yes.
whether your doctor is doing them on rounds is irrelevant, because I guarantee you they got one when they got there. So
The medical doctor does it. That's why I'm like.
But you're gonna have to know how to do that. That's part of your
Okay.
assessment on the patient. So, so use this to hone your skills and get ready for that. Cause you know, when you're out there on your own, not every place is gonna be, where they don't do them. Somebody's doing them
Right.
and has to be done. So hopefully that,
So,
and you'll pull back from your recent school to do that.
okay, so then my next question is, I reached out as soon as I finished case 7,
Mhm.
knowing, because you guys hadn't sent the emails out, all that, knowing my history questions weren't good enough,
Mhm.
my physical questions weren't good enough,
Uh-huh.
my plan didn't match what the plan that was written, didn't go together. The only response I got was when I asked a second time, am I doing it wrong for I'm sorry, the second page where you're putting all the history and physical all in
Right.
there. That's the
Right.
only response I got. I said, I want to know how I can improve. Nothing.
Yeah.
Crickets.
Well, I'm sorry to hear that. I don't know who your instructor is and I don't want to know
Sure.
the name
That's
here.
fine.
Your instructor should have 48 hours, like I said, to answer your emails. If you're not getting response, then feel free, send me an email and I'll see if I can't like rattle some chains and get you the answers that you need.
Okay.
Dr. Hadley,
Yes.
can I go now?
Now,
Okay.
with,
go ahead.
with week 7, now I went by the rubric and because of the points being given back, it was a good grade, but that
Mhm.
still doesn't explain my questions because I want to do it right.
Have you reached back out to your instructor? Because you have to understand, we can get
Sure.
our emails absolutely buried under a pile. So if you didn't get the answer the first time, then reach out again and ask for some clarifications. Be very clear in your email on what it is you're asking. If you just say, like, for instance, I keep getting these emails, I had technical problems, so I couldn't do it. And I'm
No.
like, what does that mean? What do you mean technical problems? I need specifics. I can't help
Sure.
you if I don't know that. Technical issues to me, I don't know. So
Sure.
anyway, let me just
Sure.
pause everybody for just a minute. I know everybody's got a ton of questions. There's 100 of y'all. There's one of me. I've got another Zoom call that I'm supposed to be doing in a few minutes. I cannot possibly get to every one of y'all's emails. Questions. And I hate that, but what I ask is that you first go back to your instructor. If this call today didn't answer your questions, please reach out to your instructor, see if you can get some questions, list them down there, 1, 2, 3, 4, here's my questions, be very direct about it. And keep in mind that, that it may take a day or two to get your answer back. And if not, then pull me in. I'm happy to help. But I hope everybody understands the process of the sequence of events of what happened with the week 7. I hope you feel better about week 9. I promise you it's going to be a whole lot different than what you had on the other one. And hopefully each time you do this, you'll learn a little bit more about it until every time I've done this, and like I said, I've done it forever, after doing a few, it's almost like the light bulb comes on and like, okay, now I get it. And then it makes this a whole lot easier. But I know you're learning a new program as well as having a lot of questions and that type of thing. But I promise it does get easier. We 100% believe that you can do this. Y'all are smart enough to do it. I know it. We just have to put your thinking cap on and don't forget what you already know as an RN and build on that. Okay. Yes.
I have a question. How often do you have this meeting? Like we have the Zoom call.
What?
How often do we have the Zoom call?
I usually don't. I'll usually have a call with the students at the beginning, but I'm not one of the instructors. I kind of oversee the courses, the course that you're taking, but the instructors themselves should be having some calls with y'all and and the directions. So specific calls like this, or Zoom calls like this, not something that is a regularly scheduled kind of thing, but I'll talk to him. Maybe this is something we can start doing sporadically and make things a little bit easier. Okay.
Thank you.
Dr. Hadley.
I got this, the last question, and I gotta
Okay.
go.
Yeah,
I think got patience waiting.
I fully
Yeah.
understand that you really want to go, but I have observed or noticed this since I started using iHuman. So sometimes the iHuman does not capture all the questions that are necessary. And then we ask the question in a different, we phrase the question differently. The last week 7 assignment in particular, the main diagnosis, by the time I started taking my history, I understood that it was going to be heat exhaustion, dizziness, or something around that area. But when I typed heat exhaustion, nothing came up. Ask a question on heat exhaustion, nothing. So it kind of maybe you should take this feedback to them so that they can.
Yeah, absolutely. I've got a call scheduled. I'm going to go over that whole case with them and the issues that we've had. And that's why I appreciate you all, having a feedback with us on this, and we'll get it all straightened out. Like I said, I doubt this case will ever pop up again. When we choose which ones we're going to be having, I think it's just a little more cumbersome than what we're wanting. And we're also, like I said, going to the premium cases that make the question and answer sessions a lot more intuitive and a lot easier. So, but I appreciate you all's time. I've got, I've got to get off of here. I've got to get on to the next one. But I hope you all at least feel a little bit better about this. Just hang in there, talk to your instructors, give them some time to answer. If it doesn't happen, please give me a call. All right.
Thank you.
Thank you.
For your time.
Absolutely.